Obsessive Compulsive Illness by Jones HMMBADMS. This is minor or neurotic mental illness that is characterized by thinking and doing certain actions repeatedly despite the urge not do so. It has as well varying degrees of anxiety, depression, and depersonalization. The obsessional thoughts are words, ideas, and beliefs recognized by the sufferer as his or her own that intrude forcibly into the mind. Because they are usually unpleasant, attempts are made to exclude them. Obsessional images are vividly imagined scenes often of a violent or disgusting or kind, for instance involving abnormal sexual practices. Types of obsessional acts. Obsessional ruminations are internal debates in which arguments for and against even the simplest everyday actions are reviewed endlessly. Obsessional doubts concern actions that may not have been completed adequately, such as locking a door, closing a tap, etc. Obsessional impulses are urges to perform acts usually of a violent or embarrassing kind, e.g. leaping in front of a moving car, injuring someone, stealing, or shouting blasphemies in church. Obsessional rituals include mental activities, such as counting repeatedly in a special way, or repeating a certain form of words, repeated but senseless behavior, such as washing one's hands or looking in the mirror 20 or more times at a given time. Both obsessional thoughts and obsessional rituals inevitably lead to slow performance. Anxiety. Some rituals are followed by a diminution of anxiety, whereas others are followed by increased anxiety. It is evident that obsessional patients are often depressed, and another proportion reports depersonalization. Epidemiology. Obsessional, compulsive illness is less frequent than anxiety neurosis. Etiology. Genetics. Obsessive compulsive illness has been found in about 5 to 7% of the parents of patients with this illness. Relation to schizophrenia. The few reported cases of schizophrenia following obsessive compulsive illness can be explained by coincidence. 3 organic factors. Psychological terms that organic brain disorder has been suggested as the cause. However, in most obsessional patients there is no convincing evidence of disease of the central nervous system. Early experience. Obsessional mothers might be expected to transmit symptoms to their children by imitative learning. Learning theory. It has been suggested that obsessional rituals are the equivalent of avoidance responses, but as general explanation this cannot be sustained because anxiety increases other than decreasing after some ritual. Prognosis. About two-thirds of cases improve by the end of the year. However, prognosis is worse when the personality is obsessional and symptoms are severe and when stressful events continue to haunt the patient. Management. Reassure the patient. Apply empathy on the patient. Do psychotherapy. Do behavior therapy. Cognitive therapy. Chemotherapy. Giving anxiolytic drugs, but for a short period of time. If for more than a month, then small doses be administered. Antidepressants, tricyclic drugs like clomipramine, anafranil, amitriptyline, triptazole, or imipramine, tofranil, can be given. Where anxiety is marked or severe, give diazepam 10 mg 20 mg IV IM stat in order to relieve the patient of the anxiety or tension quickly.